Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Carrie Ruller. And today we have Dr. Mariel Paralitici to talk to us today. Super excited to have you. Thank you for coming on the podcast. And can you tell us a little bit about who you are and what you do?
Thank you very much, Dr. Keller. So I am Dr. Mariel Paralitici-Morales. I am an adult, child, and adolescent psychiatrist. I trained both my residency and fellowship in New York in Harlem Hospital Center through Columbia University. And then after I finished my fellowship, I did some private work in private practice setting and a couple of clinics settings for a year. Then I moved to Florida with my husband and we started all over. So my husband is also a psychiatrist and I waited for him to finish the whole thing. In the meantime, I was doing the half private, half clinic work. And then when I moved here, I focused more on the clinic part of it. And I've been 10 years working directly in the corporate medicine world in big companies, big corporation. Lastly, I spent almost 7 years in a nonprofit FHQC clinic, federally qualified healthcare center. And that was my last employed job, as employee. Last year, yes, I went through a kind of moment of transformation of myself because I got burned out from the system. And I was about to quit medicine and I just decided to take a small break. I resigned my job, yes, and I was without a job for like 3 to 4 months until I was waiting for the new thing to come in. And I used that time to really find myself and try to get into a purpose of what I wanted to do in life. And that's how my private practice started, Psychiatry Boutique in West Palm Beach, Florida. I see both in-person and virtual patients and serving the state of Florida as a whole virtually, and then Palm Beach County more in person. And I do really love what I'm doing now because it's really what I trained for, right? The quality of our care versus the craziness of the numbers and of the other world that I just left behind. And yeah, now I am focusing on that. So I am a psychiatrist and I am a mom of 2 teens, a wife, and yeah, I'm a very active, sporty, competitive person.
Well, wonderful. Thank you for sharing that. And I definitely hear a lot about burnout in physicians. So it's nice to see that you recognize that and find out what makes you happy. And even more helpful is that you still get to practice and help other people, right? Because you're happy with what you're doing. So that's wonderful. And it must be interesting living in a 2 psychiatrist household. We hear a lot about 2 physician household, but 2 psychiatrist household, that's another level. So
It's
anyway,
fun.
thank you so much for coming on. I think today we were, just going to make it informal and talk about anything that comes up, but I think we're going to focus a little bit on depression. And I haven't discussed that with anybody yet. So can you tell us a little bit about what depression is?
So depression as a whole is a word, right? It's an emotional state. When we talk about clinical depression, we're talking more about clinical diagnosis where we have to take in consideration many aspects, duration of symptoms, how long, intensity, complexity, etc., including also how much it's affecting your function in life. So basically, those are the criteria. We need to have some sort of functioning in life that now it's making our day-to-day life more difficult. And over time, if we hit 2 weeks or more having all these struggles and having all these feelings with associated neurovegetative symptoms, which includes sleeping issues, appetite issues, somatic concerns. There's many others like feeling hopeless, helpless, worthless. Some people might experience suicidal ideations, suicidal thoughts. They can be either or, passive or active. Passive mean that it's just a thought, I don't want to be here anymore. I'm tired of this world. wish I can sleep and never wake up again. But it's not an active action of I want to hurt myself, or a plan that I am planning to hurt myself, or I am going to do this because I have the intention not to keep living anymore. So that's more active. So to be clinically depressed, you don't have to be active. You can be only passive or not having any thoughts of hurting yourself at all. Also, there's like 12 different symptoms that we need. I believe it's 6 or more to
Mhm.
fill the criteria for 2 weeks or more, right?
Mhm.
And again, with decline in the functioning of that person. There's usually comes with red flags even before that clinical depression. It's like everybody's noticing that black, dark cloud in someone. And those are the symptoms or signs that us, the people around others, should be more aware of. And that's why it's so important, the awareness of depression. It is a very common disorder and affects a lot of people, millions and millions of people, and nobody is exempt. This does not discriminate in about age, gender, sex, anyone. Anyone can have depression in our life, and anyone at some point in their life will experience at least one episode of depression. So it's a very, very concerning statistics and facts about depression out there. And it's the number one disability cause in the world,
Mm.
depression. So imagine how much money it's spent on disability only for this condition. So, it's a lot behind it. We need to be aware of so we can
Mhm.
act on time and prevent the complications that comes with it.
Do you mean patients who are on disability? Is that what you're referring to? Like
Depression is the number
medically?
one cause
Okay.
of disability, of someone requesting disability.
Right. Right. Okay.
Depression is the number one cause. I mean, yeah.
Yeah.
So it's multiple millions of people
Yeah.
disabled only on depression. Yes.
So you mentioned these signs and symptoms, and you said that there's depression and there's clinical depression. So distinguishing between the two is probably important to mention, because people may want to seek out help when it's becoming a dysfunction in their life. And that's when
Yes.
it might be time to, okay, hey, and anytime before that too, I'm sure, but it might be time when you want to ask your healthcare provider to seek help, right?
Yeah.
So time, like more than 2 weeks, right? There's a dysfunction in their home life, and then 6 or more of the signs or symptoms.
Mm-hmm.
Did you want to go through some more of that? You mentioned sleep and eating, but any
Sleep,
other ones?
eating, feeling hopeless, helpless,
Mhm.
worthless, no energy, no motivation, feeling of guilt, the sleep too much or not
Right.
sleeping at all, eating too much or not eating at all, because we can go into both spectrums. The
Mhm.
suicidal ideations are there. In general, the joy of people, the pleasure, the things that they used to enjoy before, they no longer enjoy anymore. They have tendency to withdraw or isolate themselves from their regular world. I mean, let me see if I'm missing something else. The depressed mood is
Mhm.
there consistently, but yeah, it's not like we can say I'm depressed. I can be sad, right? I
Mhm.
can just receive a phone call right now and get a bad news, and I might feel depressed at the moment. That might be a moment, an episode, right? But we usually identify we're going through some challenges, and usually after maybe a couple of hours or maybe 1 or 2 days, we move on. There's something that either we just keep moving on the wave of life, we just move on. However, when we are in a clinical depression and this state of mind continues to be prolonged, prolonged, prolonged to the point that now it's 2 weeks or more where I cannot really move on, and now everything else continue, that domino effect of decline. Now I'm not sleeping, now I'm not eating, or vice versa. Now I'm not having energy. I'm waking late every morning and going late to my job, or missing my job for a couple of days. Now, after
Mhm.
a couple of days, I get a memo, you're missing too much. That's a decline in your work area, right? Or I'm always irritable. Now I'm fighting at home all the time. I come back home angry, throwing stuff. That's a decline in my life at home. It's not normal to be acting like this in a regular basis, day after days after having a challenge 1 or 2 weeks before,
Mhm.
So it's difficult how people react to different situations. And it's different the way we put into the effort to move out of that challenge. So that is where the difference in people will be. How much I can handle, how much I can put in the effort of getting out of this challenge. And that's when the difference start to come in, and the
Mhm.
different treatment plannings, and how much sources we need here, or it's how much education, all that.
Right. How can a patient get the motivation or the courage to come ask a health provider for help?
So, first of all, it's don't be afraid. I think that we should not be the ones bringing this up in the doctor office, because some
Mhm.
people might feel embarrassed or shameful just bringing this. Some people might feel crazy if I say this, or they might judge me, or, you don't know what is inside their head. So that's why I believe it's very important, the screening of every single patient
Mhm.
that go into pediatrics or internal medicine or family medicine, general practitioner, whoever has any contact with children or adults, just throw out a PHQ-9 or a GAD-7 or some sort of screening tool. Even the PHQ-2
Mhm.
can be positive, and then say, okay, this is a positive, now a PHQ-9, just to make sure I'm not missing anything. And then if it's proper based of clinical judgment, we can say, okay, maybe I can handle this and refer for therapy, or this case might, I think I want a referral here. But if you don't get that screening, don't be afraid.
Mhm.
Don't be afraid. Ask for help, because you will find it. But in the
Mhm.
doctor's office, I believe we have the responsibility to do that first, because we don't know who will say it. We don't know who will feel the courage to really say, I need help. The same as domestic violence questions, or drug questions, or alcohol abuse questions. It's pretty the same concept.
Yeah, absolutely. I agree. And I do ask my patients all of that, or at least somebody is in the room. And I have uncovered a lot of yeses, right? And dive deeper in that with patients. And then I do have some patients who get very annoyed by being asked these questions. So I know I tried to tell them we're not trying to, make you uncomfortable, but these are just things that we can really help other people pick up on the information and use it to help them get better. But some
Mhm.
people do get offended from even being asked those questions. And
Mhm.
I get sad about that. But
Sometimes,
yeah.
but sometimes can be even cultural.
Oh, yeah.
So I think we can do the question being culturally sensitive. And
Hmm.
if there's some sort of too much irritability or so, we should explore that, because maybe it's a defense mechanism of, oh my, it could be a red flag. It could be
Hmm.
someone that might be just, trying to maybe,
Suppress all of
it's a
those
couple. If
feelings.
it's a
Hmm.
couple, and then he's the one who started getting angry and doesn't let
Hmm.
her talk, red flag, those
Right.
things. We should pick up those red flags.
Yeah. Yeah. So when is it a good time for someone to refer to a psychiatrist? And can you explain the difference between psychiatry and psychology or therapy?
So psychiatry and psychology, two different things.
Hmm.
Psychiatry go to med school, psychology do a PhD or go to college, right? And they just have their degree, their master's, doctorate, depending how far they want to go. Psychiatrist, we go to med school and we do the whole med school pathway, and we just, graduate and do our specialty. And we are known as the med management people. But it's
Hmm.
not true, because we can provide therapy if you feel comfortable enough. We are not as trained, as deep as the psychologists are in a PhD on clinical psychology. That's what they do. They do more standard testing. They do all these reports, psychological reports, neuropsychs, gifted, psychoeds, lots of these testings. However, they cannot prescribe.
Hmm.
Many states out, and this is psychologists. We're talking about PsyDs or PhD in different states. They have the capacity to prescribe. Therapists Can be a social worker, can be a counselor, can be someone who is just certified to do different type of therapy, and they can provide the same level of therapy as a psychologist and so, but they don't do testing. The psychologists do the testing. They have more credentials to do all this type of reports and testing, but the therapy part we all can do. There's different modalities of therapy, so it depends on what type of therapy that therapist is certified on, or the modality, because there's many approaches: CBT, DBT, EMDR, I mean, you name it, psychoanalytic, you name it. There's many approaches out there. So when to go to a psychiatrist. So usually when we go to a psychiatrist, it's when we have tried all the support system. That's an ideal scenario for a psychiatrist. If that happens, no. Usually the patient that I get, it's a patient that usually have no history, and I'm the first one they call. And I go over the screening and ask all these tons of questions. And, oh, but you have not done this first. You don't, but I heard that if I take this, so I try to educate them and say, but let's do the proper way, because possibly with therapy, we can avoid the use of medications. It's a process, because when patients call psychiatrists, they're already fixed that they are calling for a medication.
Mhm.
And I'm trying to really reverse that thought. I don't like to work with medication immediately unless it's really necessary, because I think that there's always some part of our life that we are not putting much effort into. And just by tweaking different areas in our life or in our self-care stuff, we can make a lot of changes. And I think I can avoid the use of medication, or at least use the minimum amount of medication on someone who really want to put the effort and the energy on work on this life areas. We can do from weight management to mental health to physical health to many areas, just by tweaking areas in our lifestyles, and make a better environment, a better version of ourselves. But it's a long educational process, because it's a journey. It's not easy, and usually the path with medication, it's quicker, it's fast. It's not. It's
Right.
like it's planning, stalking, and having trust.
So you mentioned obviously trying to limit the medication. There was a study that I was talking with a different doctor who focuses on meditation, and she was saying how meditation can be equivalent to basically taking Lexapro or escitalopram. I don't know the
Yes.
timeline, but and I thought that was really neat. So I know we could talk about medication all day, but that's not really that helpful, because the patients don't
Yeah.
really care about what medicine as much. But tell me, what is your approach with self-care to help improve depression?
So, I mean, basically, I need to know where my patient is and where they want to go. Because if they're into a deep depression, it's going to be hard to find that energy and that, to take them out to see that light at the end of the tunnel. So I need to assess where we are, complexity, and all that, and see how much they can do at this point. So I need to make sure that they are focused on doing the medication the right way, and that we are making the effort of what they choose to do first, which was the medication. And when they feel a little bit better, we are going to use that energy and momentum to try to switch that on, and then focus on that self-care. And self-care, I literally take out a paper, and I make them make a list of their most important parts of their life.
Mm-hmm.
And believe it or not, everyone misses themselves. Not single one patient has ever put me, it's my priority. Never. So I'm a wife, I'm a worker, I'm a mom, I'm a teacher. So those are their important roles in life. And when I ask them, okay, but we are missing the most important part. Where are you? Where is you around here? They are like, oh, that's right, I forgot. So it's when I start, okay, let's start all over again. Let's go with priorities. What areas do we need to work on? So we have to start from ourselves and started to debunk or declot, or however you want to say it, Let's take out and one by one all the lies we have been telling us all our lives about us and start to look for the evidence of this is not true. Let's just throw this out and move on. I am capable of doing this because I have done it before, because we have, and look for moments in their life that they have struggled maybe in similar situations and help them to see it. Hey, you have done this before. We can do it again. We just need to look for what is missing. So let's start. What do you love to do? Oh, I like to do this. How often do you do that? Oh, I haven't had the time. Guess what? We need to start doing that more often. Hey, how many things do you do on the day that you don't like to do, but you have to do it? Okay, let's see. Why do you have to do it? Because, okay, that doesn't make sense. You don't have to do that. So I tell them, I'm your interior designer. The same way that you want to tweak and change your house and move your sofa from here to here, and I want to make a picture of yourself here, and I want to see how your schedule is today or now. How would be your ideal day? And we are together going to tweak it so we can make it work for you. Then we're going to work a couple of maybe 1 or 2 weeks to see how it goes. And we tweak what doesn't work and we keep what it works. And we start like just moving here and there until we get to the point of building a very nice workable schedule that is not so draining. It's not so overwhelming for them, and they have been able to find the time to work with themselves, because now I'm giving other things that I really didn't need it to do. Why I have to be, I don't know, doing all these things for my 16-year-old who possibly can do a sandwich and possibly can, you know, we don't need to be babying them until they are 18.
Yeah.
We can start delegating stuff. They can do some of the, and we feel we cannot. But it's just about, yes, we can. Why not? Let's see what are the, and I go one area at a time. Then when we actually make the full picture together, I say, I want you to make one activity, very basic activity, simple activity for each one of those important areas in your life every day. Every day, I need you to do at least one thing that goes into your wife area, kids area, self area, me, whatever areas you choose to work on. And we slowly start adding positive stuff, removing negative habits, and starting to replace one or the other. And slowly, I mean, we picture how long, what is the time frame we're going to be working on. I work on setting different type of goals, small at the beginning, teaching them how to really celebrate the small wins along the journey, so those wins can help them to move on and give them battery to keep the momentum, things like that. I mean, I integrate a lot of life coaching skills with therapy. I don't feel I do therapy because I'm not really stuck on past behaviors and stuff. I really want them to look to the future, to see themselves forward, and to believe in themselves that they can do better or become a better version. It's not that they are doing better or anything. It's just I want to be better because they are finding their inner beauty, their inner love, their inner whatever you want to call it. But finding us first will help us to move everything else around us much easier. But when we're in burnout, for example, we don't see that at all. At all. It happened to me. I don't think I was in a clinical depression per se, but I could identify this is not me. I am totally different person. I am irritable most of the time, until I started like really digging more into it and say, okay, no, I need to really make changes here, here, and there.
I was going to say that everything that you're saying, we parallel to a lot of applications and other types of medicine and, health. Like for weight management, I do a lot of those things that you've mentioned before. And I really like the idea of how you tackle the roles that they have in life. And then obviously delegating things, which is helpful to get things off their plate so they're not overwhelmed. And then making sure that they get the things that they want done, in each of those roles a day. So almost helping them create their ideal life and schedule. So that's really, really a nice way to kind of coach them in the way, like you said, coaching and that is essentially
It is.
that as well. Yeah. So also it seems like your approach, you're not delving into the past and focusing on those kind of things that could be affecting them.
We can, but I want to use it differently. Most of them have their own therapist. They keep working with them on that. I want to really put them in action and feel that, I want them to feel the momentum. I want them to feel accountable. I send them texts. I send them reminders. Yeah.
You're saying maybe it's a synergistic thing between the therapist and you, and you're doing different approaches, both that help, correct?
Yes.
Yeah.
Yes.
That's really nice. Yeah. I like that a lot. What else would you say is important for self-care in depression?
I think that the awareness and mindfulness, it's super important. Mindfulness is again a big word, but mindfulness, it's really being mindful and aware of our own emotions. And the more mastery we have in that area, I think we can get into a point of having a pretty good control on our reactions towards our challenges and having better outcomes, because we processing so much information the right way will protect us from reacting the wrong way because of lies or different perceptions that we perceive as true, but they were not true. And if we don't know ourselves the way we should know, we will miss a lot of wrong information. We process it wrong and we will respond wrong. So know yourself. And that's the only way. It's really taking the time, reading, reflect, think about you, think about your feelings, associate with them, associate feelings with body feelings. How do I feel when I'm depressed? What I feel in my body when I'm anxious. Those things will give you more power and control to name it and say, hey, I know I'm afraid. I'm anxious. And all that is through mindfulness.
That's amazing.
You are in connection with your body and you know how to control for reaction, for later outcome.
So you think you can oftentimes prevent having to start a medication on your patients, or that is kind of your goal as well, right?
Yes. The thing is that all those things are, medication can provide some sort of more immediate response. Physically, physiologically, molecularly, we're making changes. For meditation to work, for all those things to work, we have to really be focused and doing it. The same way you have to do the medication every day and taking it as consistent as possible. We are not just meditating today. Right. I'm done for next month. No, guys, this is effort. This is time. We have to meditate every morning or every night or once a day or maybe once, 3, 5 times a week. You get your pace. Everybody's different. But, I know my magic and I have to do 20 minutes yoga every morning before starting my day. And it's a fast yoga. It's like a kind of cardio type of thing. I don't do that. I'm miserable that day. I do that. I'm like, okay, I started like fresh. So we all know we don't know. When we know what to do and we go to it, believe me, it feels so good. And you don't have to have mental illness to do all this. You don't have to be a person that have or not have it. This is for every single one of us.
That's an important point. Yes, we should all be doing these things regardless of whether you're having an issue or not. Yeah.
Yes.
Is there anything else you'd like to share with the listeners?
No, don't be afraid. Don't be afraid for look for help. There's many, many people out there that are willing to help. It doesn't have to be, it can be anyone as a start, and you will get there. But if you don't ask for help, we would not know.
Right.
So don't be afraid. The stigma is there, but we're fighting it. We're fighting it. So don't be afraid. There's many, many good people out there.
And where can people find you?
So, I'm in West Palm Beach again. My private practice, it's called Psychiatry Boutique. My website is www.psychiatryboutique.com. I am also on Instagram and Facebook, more educational, posting, educational stuff. Dr.P at Psychiatry Boutique or @ Psychiatry Boutique, both. And in LinkedIn, it's my name, Mariel Paralitici-Morales MD. Yeah, and a few ideas and projects there, but I haven't started soon, but I will. So when it's happening, I disclose that part.
Awesome. Well, thank you so much for joining us, Dr. Paralitici. Thank you for
Thank you
coming
for
on.
having me.
All right. Tune in next week, everybody.
Bye-bye.
Bye.